I'm Dr. Kelly Winarski with Kairos Connect, and today I am joined with Dr. Sarah and Dr. Sean Leatherman. They are chiropractors in the Panhandle of Florida at Mary Esther, and they run Integrity Chiropractic. Welcome, doctors.
Thank
Hello.
you. Hello.
So, I'm gonna let you guys just kind of take the reins on this one. I want you to tell me what makes your practice special. What do you want to share with a potential associate that's gonna see this and think, do I want to work for them?
Well, I guess I'll take that question. We run a very diverse and unique clinic. It's different than traditional chiropractic. What we've done is we have traditional chiropractic in place. We do sports injury care, auto injury care, regular wellness-based care, CBP, traction in the office as well. So we're doing functional and structural based rehabilitation protocols with patients that come in the door every day, all day long. We do extremities, probably 10 to 12 different adjusting techniques that will blend together. We see pregnancy. I mean, in our practice, we've seen anything from days old into almost 100 hours old. Yes. Yeah.
Fresh little newbies.
And so it's widely diverse. You're going to see a lot of cases in our office. And typically, we're not going to be the guy down the street where the easy cases just fumble in the door and they just say, hey, I want to get a whack 'em, crack 'em and out. By the time people get to our office, they've failed care and PT, they've failed other chiropractic offices, they failed medical care, and they're looking for something different. And so we have created a reputation in town for taking on the hard cases. We see post-surgical rehab cases, we see pre and post-surgical. And we see a lot of cases where other chiropractors don't want to take the patient. And actually, in my opinion, those cases are fun because at the end of the day, end of the week, end of the month, it really makes you look like you're a guru when you get people better and other people don't. So, that's the kind of practice we have. We do weave in home-based care as well, nutritional protocols. We'll even do insoles and in the office, as well as durable medical products that will weave in and out of chiropractic programs. And what we'll see a typical case in our office will be a patient that starts care that's going to see us for about 3 months straight through. And then after they go through their pre and post exams, x-rays, that sort of thing, most of those patients are going to wind up being wellness cases after a while. And we'll see them once or twice a month, ongoing care.
Sounds like you have like kind of the best of all worlds in the chiropractic world. And you guys are hiring for one associate right now.
Correct.
And it sounds like they're going to get a really, really diverse experience in your office.
Yes.
And you kind of have a pretty clear idea as to who that ideal associate is going to be. Do you want to share who you're looking for?
Sure.
We had read a book. This has probably been a decade or so ago now. I can't remember the name of the book, but it was really great. And as we worked through it, we were able to nail down the characteristics in our office, down to heart and drive. And so somebody that comes into our office has to have both. So if you're just, driven, where's your heart? And again, if you're leading with your heart, then you don't have enough pep in your step. So the best candidate would really ideally have both, somebody that is a self-starter and has good leadership qualities.
Yeah. Some of the other things that you and I had talked about were science-minded, detail-oriented, really kind of that driver personality. On the flip side of that, who would not be a good candidate for applying for this position?
Well, we had talked about before, we've done, again, a lot of reading and a lot of leadership books and different things like that. And one of the things we did was the DISC profile. And so somebody who's going to have not an S personality. So anybody who's just kind of slow and steady and
kind of passive, kind
thank
of
you.
push over
Nice way of saying. Yeah, you really have to be able to hold your own. We have strong personalities. All of our team members have strong personalities in their own way, and we expect that. We like that.
So we've had 5 different associates in our office in the past 10 to 12 years. And what it all really boils down to is if you're a leader, you're going to excel in our office. And if you're not a leader, you're going to struggle. Our patients, they come in the door, they are looking to be led. And as the doctor, you have got to be strong enough to stand in front of that person and say, I'm going to be able to help you. And, obviously it's based on clinical exam findings and if we really can help them.
Yeah.
However, you have to be able to lead them into a different perspective of their life. They're coming into our office suffering. They're coming in defeated positions. They do not have the tools to take care of themselves on a physical basis. And we're going to be the ones that are providing that. We've had 3 amazing associates in our office that we hired because they were a leadership mentality. They didn't even have the skill sets that we needed. And within 3 to 6 months, they were killing it. They were driving. They were known in the community. They've all gone on to move across the country, open their own practice or bought their own practice, and they're all highly successful.
And you support that, obviously.
Absolutely.
Yeah.
Absolutely.
Yeah, we're still in touch with our latest associate. Well, one of them, he's down in Tampa. So I just reached out to him today and I was like, hey, I see that hurricane's coming your way. Let us know if you need to evacuate. We have
you can come work for us.
We have a couch right now.
Here's the cool thing about that as well is our associate before Dr. Sam. Dr. Sam just moved to Tampa. We helped him vet a practice that he purchased, and he's doing his thing down there. We've got 2 or 3 patients right now that co-treat with Dr. Sam and ourselves because they travel. And so I'm like, when you're in Tampa, you go see Dr. Sam. When you're in Mary Esther, you come see us. I had a patient that was just referred to me from Atlanta from a lady who is a healthcare practitioner. She's like, I want you to go see Dr. Sean. I did all the evaluation, came up with the treatment plan. I just referred her to my associate or referred him to my other associate in Atlanta, Dr. Bach, who used to work for us for 4 years. He's going to manage that case now. And this patient's going to come back once every 3 months or once a month. He's going to get a re-exam at my office, but he's going to be managed by Dr. Bach in Atlanta. And so creating those types of relationships and knowing that I can trust these other doctors around the country to take care of our patients is amazing, especially because we live in a military community and we have so many patients that are coming and going and they're seeing chiropractors in other areas. And then when they're leaving, they're asking us, where can I go? And we're researching what doctors in that area can I refer to so they can have a high level of care. And so it's just one of the things where an associate that comes into our office is going to see a lot. We are going to expect a lot out of them. However, we're also going to spend the time mentoring and giving the tools to them, adjustment skills, management skills, exam skills, x-ray mensuration skills. We're going to grow them as much as possible because obviously I want them to do a good job for my patients. And they're a reflection of us in the community. So we want the best for them, as I would hope they would want the best for the practice.
Absolutely. So high level of responsibility, high level of reward. Lots and lots of training. I understand you're getting them basically CDP certified, which is corrective care. Your salary is right on par. You're starting at 85K base is what I understand. And there's that graduated bonus structure, which all new graduates want to see. They want to see that their effort is matched by their earning potential. So all looks great. Tell us a little bit about the area. Why would somebody want to go to the panhandle of Florida to live?
Well, we are sitting by the pool conducting this interview.
It must just be horrible where you guys live.
It's so hard to live here. Hey, if T Swift is singing songs about it, must be pretty great.
That's right. So, so Destin's nearby. What else is nearby?
Pensacola, Panama City. Those are very close. New Orleans and Birmingham are a 3.5, 4 hour drive away.
Wow.
Atlanta's 5 hours.
Atlanta's 5 hours.
Orlando is 6.
That's crazy. If I drive 5 hours, I'm in Iowa.
Yeah. So there's a lot of places you can get to, but the bottom line is this is a great place to raise a family. It is, there's traditional family values where we live. When we first moved into the neighborhood that we're at right now, we didn't realize it, but the police would patrol the street and they would lock your door for you and leave you a note on the door that said, hey, we locked your door. We noticed your door was open.
That's
and we're
amazing.
like, crazy, right?
So we have teenagers and they would leave it.
Yes. However, we have the best beaches in the United States, sugar white sand beaches, crystal clear water. The water is warm year round. You go to California in the summer, it's 55 degrees. Well, 62, 64 is about as cold as it gets here as far as the water temperature is concerned. and we get 3 really good seasons, and we might get winter for a month. So it's a very active
Mm.
place to live.
So is
Now,
that right if I come visit during tornado season?
sure,
Just
yeah,
asking for
absolutely.
a friend.
Yeah.
All right. Well, it sounds like an absolutely beautiful location, beautiful practice. Do you have any advice for someone who's considering applying for any position or for your position specifically?
We only have like 10 minutes, right?
And okay, one piece of advice.
Um, the best piece of advice I could give an associate or a doctor looking to become an associate
Yes,
is
please.
vet the clinic.
Vet the clinic.
Vet the clinic. We were associates at one time as well. Luckily, I didn't have to vet a clinic because we were referred by somebody who's very high level in the chiropractic profession, and I was able to trust their opinions of the doctor. We were able to jump into a clinic that did all kinds of stuff, saw lots of patients, had big
Mhm.
connections. We learned a lot. We saw a lot in our first year. You're never going to see this in your first 5 years of practice. We saw it all in our first year of practice. And so that helped mold us. However, if I would have gone to a clinic that didn't have that type of capabilities, what would I have learned? And, talking to the associates we've hired in the past,
Mhm.
Dr. Sam probably said it best. He said, listen, I've been in practice 3 years and I saw more in 3 months in your office than I did in my first 3 years. And I feel more confident as a doctor now than I ever have. Dr. Bach said virtually the same thing when he came to work for us. So, vet the practice, vet the people you're working with.
Don't be afraid to get your hands on people and adjust as much as possible. That's just something we're seeing with some of the newer grads. I don't know, just side note, but afraid to adjust, and they're not really getting good x-ray skills. They're not taking a lot of x-rays.
Yeah.
And so that's primarily what we do in our office. Almost everybody, gets a set of films. So being confident with that, being comfortable with that, and being willing to just jump in and learn. And if read as much as possible, take as many seminars as possible. Like, your CV is ridiculous. It's pages and pages, but it's taken a wide range. We both have, but I'm not currently on the tables. But it's nice to have different parts of the chiropractic profession that you can pull from when you have that patient in front of you.
And ask questions.
Yes.
Associates that don't ask questions, they're never going to make it. They're just not. The person that's peppering with you with questions over and over and over, even if they're asking the same questions, that's the person you want on your team, because they're eager for knowledge. They're trying to learn. They're upping their game. That is huge. You should be asking questions every day. Every new doc you meet, no matter what they do in practice, you should be asking questions.
And don't be
Solid
afraid
advice.
too.
Say
And
that
so
again.
it's like, tell our boys, you either win or you learn something. Either way, you win. You know
That's
what I
true.
mean? So mistakes are okay. What did you learn from it?
Solid advice from solid doctors. So thank you so much for joining me today. We're hiring for an associate in Mary Esther, Florida, with Dr. Sarah and Dr. Sean Leatherman. To apply for this position, send your resume and cover letter addressed to Dr. Sarah and Dr. Sean to info@kairosconnect.com. We look forward to hearing from you. Thanks, docs.